IPHA. Today's topic is on anemia and worm infestation, menstrual hygiene. Now I invite Dr. Sangeeta ji for further proceeding. Sangeeta madam.
Yeah. Thank you, Dr. Prakashvir Arya. Yes. Respected all. Together with UNICEF, FOXY, IAPSM, Indian Public Health Association, Youth Lead Voices, Central Edge has come up again on 18th August today with a new topic, Wave 18. This time the topic is totally different but very common one. Let's iron out anemia in the youth, deworming and menstrual health and hygiene. Did you know that anemia silently affects millions of young people, especially adolescents and young women? Low iron level don't just cause fatigue, they impact growth, learning, immunity, and even future motherhood. Anemia is preventable and treatable. Strong blood means strong youth, ready to study, work, dream, and achieve. Let's come together and iron out anemia. Another topic is menstrual health and hygiene. For breaking the silence on menstrual health. Menstruation is natural, but the stigma around it affects education, confidence, and health of millions of young girls and women. Why this? Awareness talk today because to bust myths and taboos, share practical tips for hygiene and self-care, discuss nutrition, mental health, and body positivity, empower youth to talk openly and confidently. Healthy periods, healthy future. So, for today's webinar, I request our second moderator, Dr. Shibu, to invite Dr. Hema Bindu Singh to give welcome address and for further proceedings for the inaugural session. Over to Dr. Shibu.
Thank you, Sangeeta Madam. Respected Chairperson Central AHA, Dr. Hema Bindu Madam, and other dignitaries, good afternoon to all. Well Adolescent, Vibrant and Empowered, Wave 18. Empower Your Program Series is one of the prestigious program of Central ASA. We are celebrating 18th of every month as Youth Wellness Day. The program started in 18th March 2025 in association with UNICEF, IMA, FOXY, IAP and Indian Public Health Association Youth Lead Voice. As usual, today also we have two topics, anemia and deworming and menstrual hygiene. For welcome the gathering, I would like to invite our vibrant chairperson of Central AHA, Dr. Himabindu Madam, for inviting the gatherings. Dr. Himabindu Madam doesn't need any introduction. Madam is Additional Director of Medical Education, Principal RMC, Telangana, Professor of Pediatrics and Neonatology. Over to you, Madam.
Thank you, Dr. Shibu. Nice to see you and Dr. Sangeeta leading this program. Dr. Shibu is our esteemed executive board member from Kerala, and he was in charge for this program along with Dr. Sri Salam, Dr. Sangeeta Lodha, and Dr. Samisha. And really congratulate this group who's taking up this program every month. And as the chair of Adolescent Health Academy, we all know that we are celebrating the Silver Jubilee year this year. And in this Silver Jubilee year, it was my vision to do a lot of activities which impact the community also, along with our academics. So the community impact, this is a community connect program of AHA, the Wave 18. So this is the youth-led, youth-initiated program. And this was, we had this talk with UNICEF. And UNICEF, always comes together for any long-term impactful programs. So we assured UNICEF that we will give a long-term impactful program. It's not just one event. So we are going to continue this program every 18th of every month, and as celebrating this as a Youth Wellness Day. So this, I acknowledge the presence of Dr. Salima, who along with me, both of us conceived this idea last year in 2024. And I said, I'll take it up during my chairmanship. And then Dr. Saida Hube Ali, who's the national in charge for the Adolescent Health Country India office, he has given a lot of support to us. And we are also doing youth consultations across various regions in our country. So where we are taking the youth voice, youth perceptions, and involving them, engaging them. We strongly believe that unless we engage our youth as change agents, we cannot really have big impact in our community. So we are creating a lot of modules as an academic body. as one of the largest chapters of sub-chapters of IAP, we are a dedicated pediatricians who are really working in the community in a big way. I think we are the only chapter who's doing a huge, largest contribution to a community work. So we are developing a lot of modules for capacity building our common pediatricians on how to talk to adolescents, how to deal with their problems, how to do counseling. We are run a counseling course. We also had, we are coming up with a boys module. We are already running some of the zones very successfully, focusing on the adolescent boy. We also had, thinking of now rolling out a drive on adolescent immunization, which is need of the day. And we are thinking beyond newborn and, of course, they are important, but adolescent age group is also very, very important as they are 25% of the population and they have a lot of risk factors which the normal pediatricians are not normally trained how to handle. Mental health issues, sexual wellness, then digital wellness, metabolic health. These are also very crucial areas. And we also now coming with youth wellness workshops throughout the country. So we are doing a lot of programs under AHA, and I'm really blessed to be supported by very effective teams. Each team is very excellent. Each module who are working, contributors, reviewers, editors are doing excellent job, very energized. And I really thank all the EB members, OB, everybody who's working with me. And let's really create, impact. Let us go to the community. I requested the team today also to release 2 sets of PPTs, one for anemia and one for the menstrual hygiene. 10 slides each, very simple slides, which can be used in the community. So after this webinar, where we are involving even not only IAP, we are involving UNICEF, the youth are also joining here, the parents are also joining, and this is open for the common youth. And we are also involving IMA, FOXY, after the Hyderabad declaration. The last June, I think 18th, we have signed this document in the Hyderabad, where all the organizations, 7 organizations have signed that we all will go to the community and work, reach out to 1 million adolescents. That was amazing. And we all have come together. So this, we have to reach that task. The task is very huge, but it's not doable. If each one of us can do at least 100 adolescents, if we can reach out, we can definitely reach that number. So I urge each one of you to spare your valuable time to go to the schools, colleges, or wherever the adolescents are to speak about these 2 topics the next 1 week and report back to the HA so that we can document this impact. So with this few words, I appreciate Dr. Shibu, who's our EB member from Kerala, being in charge of the program to further energize this program because we need to have to connect with all the other organizations also. And Dr. Salima is also here, who's giving us real support for me to really connect with other organizations. I acknowledge the presence of Dr. Apurba. I welcome you, Apurba, from Foxy. He's appointed as a nodal officer for this Wave 18 program to be celebrated 18th of every month. And they are huge numbers. Apurba, you all can create a big impact along with us. And IMA organizations also with us. There are many organizations with us. I think it's just a beginning. And over the next few months, I think we have to create a tsunami of adults in health, reaching, empowering Yuva, and we all can do it. Thank you. I welcome each one of you, my friends and colleagues, respected seniors from all organizations who are here, especially the youth. You are the ones who make this special. I welcome each one of you. Thank you. Over to you, Sangeeta and Shibu, for the rest of the proceedings. Thank you.
Thank you, madam. Next, I invite Dr. Saeed Hobbe Ali, health specialist.
Just let me 1 minute, Shibu. I just know, Dr. Ali, good afternoon, and I welcome you. You told me that you're very busy. Still, you have taken out your valuable time. Thank you. I was just appreciating UNICEF and you especially that you had always been very, very supportive of AHA activities. And I promise you that it is not one-time affair. They are going to give you a large, I think, a sustained program. And we want to reach out to the 1 million, a commitment from AHA and IAP and all other organizations as UNICEF and along with you will definitely do that. Thank you, Dr. Ali, for your presence. We welcome you. Yeah, over to you. Back.
Dr. Saeed Hobbe Ali, health specialist, UNICEF India Countries Office. Dr. Ali has been working in UNICEF since 2007 in various capacities of Bihar, Uttar Pradesh, and Madhya Pradesh. He carries extensive field of experience of RMN CHA and immunization. Over to you, sir. Dr. Said, sir.
Thank you. Thank you very much, sir. And respected Madam Hema Bindu, Madam. Thank you for the organizing this, very judicially on 18th of every month. And as you mentioned, Madam, we are completely with you on this. Today's topic is particularly very important if we talk about menstrual hygiene management. Just to bring to attention of everybody that till till 2025 we are all working for the increasing the menstrual hygiene projects in the country. Until there was no specific standardized module released by the ministry. So UNICEF has helped the Ministry of Health and Family Welfare for development of a standardized package of training on the menstrual hygiene management. We piloted the feasibility of this module in SIHFW and SCERT Delhi in 2 batches. And now on this particular menstrual hygiene day in the country, the module along with its case studies and the social digital media materials have been now released by jointly by the Ministry of Health, Additional Secretary and MD NHM, and also the Joint Secretary of Education. So I am pleased to share that this standardized package is now available, and we will be happy to share it with IAP and FOXY also. And we are also partnering with the ministry and the states to scale up this particular training package to streamline the process of menstrual hygiene management across the country. One is this, Madam, we'll be with you. The second point is, yes, the country is still struggling and fighting for anemia. Uh, Government has the WIF program and other things, but I think beyond everything, we have not been able to improve actually on anemia. We are still our ladies and the pregnant women are more than 50%, and the boys are almost 30 to 35%. Now, the recent report of Niti Aayog, which mentions the lead toxicity level more than 5 micrograms in the country, and lead is one of the metals which really contributes to anemia. So we all technical experts need to look at the other causes of anemia rather than only looking at the iron deficiency, because it's not only the iron, because lead toxicity will also inhibit the absorption of iron, and the symptoms of lead toxicity are same as the iron deficiency anemia. So we need to look beyond iron deficiency now for combating the issues of anemia in the country. Anyways, Madam, thank you very much for calling me, for inviting me. Thank you. Over to you.
Thank you, Dr. Ali. I just want to say one word here that Dr. I think IAPHA, we have also come out with menstrual hygiene module. Dr. Deepa Pas is here. Actually, I've given her the task and she has also come out. Maybe I think we can share these modules with each other. And actually, we are looking at running this program for our own pediatricians. So we'll definitely coordinate and work together on this angle also.
Yes,
Yeah,
thank you very much.
Yeah. Yeah.
Thank you, Dr. Said Ali, sir. Next, I would like to invite Dr. Apurva Kumar Datta, Medical Director, Sri Durga Clinic and Fertility Center, Dhanbad, Jharkhand. Sir is the chairperson of Sexual Health and STI Committee FOXY 2024 to 26, and he's also editor of FOXY Focus on Sexual Health. Over to you, sir.
Thank you.
Apurva,
Yeah,
sir.
thank you so much. Thank you so much, sir. First of all, I just highlight. First of all, I would thanks to Dr. Hemabindu Madam to start this initiative. Now, this is very important. And today, the topic which ma'am has chosen, two very important topic. First is anemia. So, what the Ali sir has currently pointed out now, because when we are as a gynecologist, when we are seeing the patient, now on the very first instant, what we are seeing, the hemoglobin is very low. Now, why so? The reason being the adolescent are anemic. So though when the adolescent are anemic, though when they are become adult, when they are actually pregnant, then they are really anemia, and it causes consequences of the side effects or the complication during the pregnancy. So it's a very important to put on adolescent anemia. And I always used to say when I'm giving lectures or something like that, when the patients are coming, the adolescents are coming for any issues. Like for us, they are coming with the menstrual problem. For us, they are coming with some another, the PCOD, etc., etc. So just give a hemoglobin, test hemoglobin, and detect the adolescent and childhood anemia. and treat it, properly. Now, this is very important. Secondly, yes, many times when we are giving the iron supplement, etc., the hemoglobin will not increase. The reason being, it's not only the iron deficiency anemia, but it's all the other anemias is also not very uncommon nowadays. So this is very correctly Habbe is pointed out. Secondly, the menstruation. This is again is still a taboo in our country, and we are doing a lot, but still we are lacking behind. And even the the educated person, educated families are very much who are actually they are have a lot of misconception regarding the menstrual cycle. So what I am doing, no, in my OPD, when I am doing the OPD in the waiting area, I have few pamphlets are there. The pamphlets regarding the anemia, the pamphlets regarding the contraceptive, including the adolescent contraceptive, the pamphlets, the information in a regional language regarding the myths and misconception of the menstrual cycle. So what if they are, when the patients are waiting in a waiting area, so when they are seeing that, they got questions and they are asking us. So this is a thing, and I know what the Himabindu madam has started, it is just starting, but I am, believe me, when we are doing together, definitely we will miss those misconception around menstrual cycle or the anemia, we are able to fight it. So thank you so much to having me today, and I am here and definitely share my experience in due lectures. Thank you so much, Sibu sir. Thank you.
Thank you. Thank you, Dr. Aburbas, sir. Our next agenda is the announcement of the result of quiz 5 and the release of quiz 6. For this, I invite our vibrant leader, Dr. Samir Shah. Over to Dr. Samir Shah.
Can you stop your presentation? I can share this. So, dear friends, very good evening. And we all know learning with the help of the play will be definitely considered as one of the best thing to that we can incorporate our regular day-to-day activity. So same thing for the our students and our adolescents also. They are really happy to learn with the play in the, and the quiz is the best way to get that such type of the play. And for that, since February, we are coming with this Wave 18 quiz start. This is a sixth episode what we are going to release. And with that thing, many of the students are getting the knowledge and they are empowered with the current topic what we are going to discuss. And with the help of the our adolescent health academy, we give this basic instruction related to this. And in the adolescent 2025 next month on the 20th of September, we are going to play the grand finale of this quiz. And I requesting all the participants who are really enthusiastically work for that. We are definitely getting a grand finale physically. We have selected six people, and this is the last quiz that we could consider when we are considering the consistent six players who are getting the highest mark. We are going to invite them in a physical manner in the Ahmedabad. We are going to provide them the stay also and the traveling allowance of the second AC, so they can join us in a grand finale in a great way. So this is the one of the good initiative along with the different initiative every month we are doing in the 18th. Next 28th, we all become the witness of this grand finale. So let's release the first result of the fifth quiz, that is the we had discussed last month, and that is about the sexuality. And we luckily get that the out of all the three winners get it 25 marks out of 25, and the winners are Yushita Manchanda from the Haryana, Vatan Kumar from the Raebareli, and Srimegda from the Hyderabad. So heartiest congratulations to the all the three young winners who would get the excellent 25 to 25 marks. And this is the award of the certificate award for the winning the online quiz to all the three.
That's great. Congratulations, Dr.
Now
Samir.
Thank you.
A special appreciation to you, who is conducting this every time, every month consistently. Thank you.
Thank you, madam. Thank you. So now it's a time to release the IAP quiz to 6 on the 30th of the and this is remain open till the 30th of the August. And after the getting the all the quiz result, we will release the final 6 who is going to come to the Ahmedabad for the grand finale, and that will be the we will inform in the next session of the wave 18. And this is a QR code. Everybody can scan this thing. We will release the QR code along with the link to for the our adolescents between the age of the 13 to 21st year, and they can attempt them. And let's try to get the entry in the grand finale. Thank you. Thanks for. Let's continue with the today's session. Thank you.
Thank you, Dr. Samir Shah, sir. We are going to our next agenda, panel discussion with today's teams with experts. I would like to invite Dr. Sangeeta Lodha to join with me for moderating this session. Dr. Sangeeta, madam.
Can you see my slides?
Yes, madam.
Yes, full screen.
Okay,
Abhi
just a
nikal
minute.
gaya.
Then I'm going to share it again. Now, today we are again coming up with directly to the session we are going to start. And before that, I just want, can you see my screen?
Yes, ma'am, we can see.
So the first panelist is Dr. Sunuzan. Dr. Sunuzan is a Caritas Mata Hospital, Kottayam. She is a Vice President-elect IP Kerala, organizing
make it
chairperson.
slideshow. It's not slideshow.
Just a minute. Right. Dr. Anita, will you please play the slides if you are having backup? Dr. Anita?
Yes, madam, playing. Just one moment. I'll play.
So, yes, I'm ready. Yes, it's okay from my side. Okay, Dr. Anita, can you see my screen?
Yes.
Now it is, I think, in a slideshow mode, right?
No, it's not
No?
in slideshow mode. No.
Okay.
Go to the slideshow up.
Dr. Anita, you please play the slide. No, Dr. Anita, you please play the slides.
Yeah, 1 second.
Yes.
One second.
Yeah, no problem. So the meaning of wave 18 is W stand for well, A stand for adolescent, V stand for vibrant, and E stand for empowered. So this is wave 18. And why it is 18? Because 18 is just related to teenage. So the total whole year, the program is going with the name of wave 18, where we are just trying to bring a wave amongst all the youth, pediatrician, adolescent health academy workers to bring the change.
My slides are available now, madam.
Aware.
Dr. Anita.
Can see my slides?
No.
Otherwise, I will just try to play again.
Otherwise, you go ahead with the normal thing. Doesn't matter.
Yeah.
Let it be.
Yes. Can you see?
Yes.
Yes. It's absolutely fine.
Yeah, slides are seen, madam. You can start.
Yes.
Sangeeta, madam, your slides are seen.
I'm playing now. It's okay. Say now. Hello, hello.
Yeah, they're visible.
Hello.
Dr. Sangeeta, they're visible.
That's it. Yeah, Dr. Sonozan, just I'm going to introduce me all the characters, Mata.
Madam, I think my slides have got connected. You can start. I will click change the slides for you.
Hospital, Kottayam, Vice President elect. I am playing the slides. And the second panelist is Dr. Srinivas B.H., Developmental Pediatrician, President elect 2025 IP Mysore branch, past Secretary for Mysore Adolescent Health Academy. And the third panelist is Dr. Deepa Pasi, Senior Consultant, Apollo Hospital, Noida and Delhi. The fourth panelist is Dr. Anita Patil, Adolescent Consultant, BARC Hospital, Mumbai, Executive Board Member, IP Mumbai 2025, Editor, Women Pediatricians Forum, Publication 2025, Trainer of Mission Kishore Uday, of some young adult, conducts school awareness programs in Mumbai. So now, going to start with the panel discussion. First part is going to take by Dr. Shibu. So I request Dr. Shibu to just take further proceedings. And in first round, we are just covering iron deficiency, anemia, and deworming. Over to Dr. Shibu.
Thank you, madam. Dr. Sunujun, madam.
Yes, Dr. Shibu. Yeah.
Shall I start?
Okay.
Yes, sir. Please go ahead.
Regarding the iron deficiency anemia, madam, what is iron deficiency anemia?
Okay. Thank you, Dr. Himabindu, Dr. Sangeeta, Dr. Shibu, Dr. Samisha, all for the opportunity. Okay. Anemia, as we all know, it's a critical health problem affecting women and children more. And iron deficiency anemia is defined as a decrease in the amount of hemoglobin due to iron deficiency, or less than 2 standard deviations, HP level less than 2 standard deviations for the age and sex. And for adolescent, they have a physical spurt of growth during the adolescent period. And as Dr. Apurva has pointed out, adolescents are the future mothers. So we should be careful about their health. And less than 12 grams per deciliter, HB less than 12 is taken as the cutoff of iron deficiency anemia for adolescents.
Madam, what are the common causes of iron deficiency anemia in adolescents?
There are two important causes. One can be nutritional and other can be non-nutritional. And I think the most common cause is the nutritional cause because they have an accelerated increase of growth and they have a increased requirement of iron during the adolescent period. But their intake will be very poor. That is the poor dietary intake of iron. Then low bioavailability of iron due to habitual intake of cereal-based diet high in phytate. So the iron absorption is lowered due to the increased absorption of phytates. So that is the diet is the most important cause for dietary deficiency is the most important cause of iron deficiency anemia. Then coming to the non-nutritional causes, first cause is heavy menstrual bleeding in adolescent children. Second, the other causes can be hookworm infestation, teenage marriage and early pregnancy, H. pylori infection. That also causes iron deficiency anemia by affecting the bioavailability of iron. So these are the main causes of iron deficiency anemia in adolescents.
Well explained, madam. What are the symptoms of iron deficiency anemia in adolescents?
Okay, the symptoms can be the most often symptom which we see is pallor. The child will be mostly white in color, if you say. And the other symptoms are they can be fatigability, easy fatigability, chills, decreased cognitive function, and dizziness. They will have some pica for certain foods. And if the HB is too low, there may be loss of appetite, restlessness, lethargy, tachycardia, and in severe cases can go in for heart failure too. The most common symptom is pallor.
In previous slides, Dr. Anita, previous slides.
Yeah.
Yeah. Madam, what are the benefits? No, this no. Previous slide.
Yes.
You need to go back.
Go back. One more.
Yes.
Okay. Madam, how is iron deficiency anemia diagnosed?
Okay, the first test is HB, hemoglobin that will be less than 12 gram percentage. Then we can do the peripheral smear, which shows aniso. In severe anemia, there will be anisopoikilocytosis. And the three most important tests is MCV, that is the mean corpuscular volume will be very low, cells will be microcytic, and they increase red cell width. And serum ferritin, that is iron storage level, that will be less than 15 nanogram per ml in children above 5 years. Serum iron will be decreased. These are the accessory tests. Serum iron will be decreased, iron binding capacity will be increased, and transferrin saturation will be less than 15%. And serum iron and transferrin iron binding capacity to be tested in the early morning hours with an empty stomach. And we have to differentiate iron deficiency anemia from other anemias, that is especially thalassemia and all, which causes same peripheral blood smear picture of microcytic hypochromic anemia. And there we use that Menser index, that is mean corpuscular volume divided by red cell width. And if it is more than 13, that suggests iron deficiency anemia. And if it is less than 13, that suggests a beta thalassemia carrier. So these are the common tests for iron deficiency anemia in adolescents.
Okay, madam, well explained. Madam, what are the treatment modalities for iron deficiency anemia?
Treatment, if the HP is very low, and first way, I think dietary management is there. There should be, we know all the iron-rich food should be given. And the second one is the oral replacement of iron, that is ferrous iron to be given. And the dose is about 3 to 6 milligram per kg per day, elemental iron of iron, that once daily. Single daily dose we can give, and that should be rich in vitamin C, since vitamin C increases the absorption of iron. And avoid excessive coffee, tea, milk, yogurt, etc. And the monitor, you should monitor retic count every between 7th and the 10th day. And we have certain programs in government, that is WFS, weekly iron and folic acid therapy given once in a week. In iron deficiency anemia, we give 100 milligram of iron plus 500 milligram of folic acid for 52 weeks. And deworming also should be done regularly. This is the treatment for iron deficiency anemia.
Thank you, Sunil madam, for the crystal and clear answers. Thank you, madam. Over to Dr.
Thank you.
Sangeeta, madam.
Yeah. Now, I'm just inviting Dr. Deepa Pasi to just answer my few questions. We have divided the questions in all the panel amongst all the panelists. So now this is your turn, Dr. Deepa Pasi, because it's a rapid fire question answers you have to give us. My question is, what are the some dietary sources of iron? Over to Dr. Deepa Pasi. Yeah.
Am I audible?
Yes.
Yeah. Good afternoon, Dr. Sangeeta and Dr. Hema, for inviting me at the last minute. Thank you so much. I'm part of this team now. Well, the dietary sources of iron, as you all know, there are animal sources as well as the plant sources. So the animal sources are from the heme, that is the red meat, liver, chicken, fish and eggs. And the non-heme sources are the green leafy vegetables like spinach, broccoli, legumes like beans, lentils, chickpeas, and fortified cereals and nuts, and also dried fruits like apricots and raisins. But the thing is, as Dr. Sonu, the previous speaker, she mentioned that vitamin C is very important, like citrus fruits and tomatoes, because they help in the absorption.
Okay. Very nicely just presented the answers, madam. Now, how can iron deficiency anemia be prevented?
Well, the best way is to eat a balanced diet with iron-rich foods. And of course, we have to combine the non-heme foods along with vitamin C. Avoid excess tea and coffee because they reduce the absorption of iron. And regular deworming is very important, especially in endemic areas. And last but not the least, the government endeavors of folic and iron and supplementation to the adolescent girls. This is working very well in prevention of iron deficiency anemia.
So, okay, Dr. Deepa Pasi, now just tell me, what are the consequences of untreated iron deficiency anemia?
Well, iron deficiency anemia leads to persistent fatigue, weakness, and poor concentration. So it can also lead to impaired growth and development in adolescents. It further reduces the immunity and makes the adolescent more prone to frequent infections. And not only this, a weak adolescent girl will become a weak mother, and that will lead on to worse outcomes like preterm deliveries and low birth weight babies. And sometimes severe cases can also lead to breathlessness and heart strains and even developmental delays.
Correct. Now, just tell me, can iron deficiency anemia affect academic performance? And
Yes,
how?
many studies have been done which show that iron deficiency anemia affects the cognitive functions because it lowers the attention span, memory, and learning outcomes and capacity of an individual. And as a result, this leads to poor academic performance, leading to low test scores and decreased participation. And it improves well after iron supplementation, as a previous speaker has mentioned, what all has to be taken and how much dosage it has to be taken in.
Thank you, Dr. Deepa. What is the prevalence of iron deficiency anemia in girls between the age group of 15 to 19 years especially? I just want to know.
Yeah, the National Family Health Survey 5 done between 2019 to 2021 says that in India, almost 59 to 60% of the girls in this age group are affected. And even the meta-analysis says that 60 to 65% in this age group are there.
It's perfect. Now, Dr. Shibu, you just take the further questions from Dr. Anita Patil. Over to Dr.
Okay.
Shibu.
Okay, thank you, madam. Dr. Anita Patil, welcome and good evening.
Thank you, Dr. Shibu. I thank Dr. Himabindu Madam, Dr. Sangeeta Roda Madam, and Dr. Prakash for inviting me. So,
our questions regarding iron deficiency anemia continuing. So what is the next minimum hemoglobin value required for girls aged 15 to 19 years?
for girls aged 15 to 19 years, the minimum hemoglobin value is 12 gram per deciliter. A lower hemoglobin level indicate anemia, which can have various health issues.
Then what is the minimum hemoglobin value required for boys? Same age
For
group.
boys, the age 15 to 19 years, the minimum hemoglobin value required is 13 gram per deciliter. It is seen that for the same age, the boy have 1 gram per deciliter more than as compared to the girls. It is said it is due to the estrogen and androgen effects. Estrogen suppresses the RBC protection while androgen stimulates the RBC protection.
So it's 13 for boys and it's 12 for girls.
12 for girls, correct.
Okay. So which vitamin will enhance the absorption of iron?
Vitamin C is the vitamin that significantly enhances the iron absorption. It does this by converting a ferric form of iron to ferrous form, which is soluble and easily absorbed. So the foods which contain citrus fruits and foods which contain citrus fruits and tomatoes, which contain high vitamin C, it is advisable in case of anemia.
Okay. What is the effect of drinking tea on iron absorption?
Drinking tea, especially black tea, can inhibit the absorption of iron, particularly in a non-heme iron found in plant-based foods. This is primarily due to the tannins in tea, which binds to the iron and makes it harder to be absorbed. So the tea inhibitory effect is more pronounced on plant-based irons. More, the tea consumed greater the inhibition of absorption of iron from the GI tract. So regularly drinking large amount of tea, especially with meals, can potentially lead to the iron deficiency anemia. So minimize the impact of iron absorption. Consider drinking tea between meals rather than drinking tea along with the meals.
Here the last question regarding iron deficiency anemia. What are the prophylactic dose regimen and color code of iron folic acid tablets for 10 to 19 years boys and girls?
Under the Anemia Mukta Bharat, that is the program of the government for school-going adolescent girls and boys in an age group of 10 to 19 years, weekly 1 iron and folic acid tablet. Each tablet contains 60 milligram of elementary iron plus 50 microgram of folic acid. The color code is blue color.
Thank you. Thank you, Dr. Anita Patil. Over to you, Sangeeta, madam.
Yeah. Okay. So now the first round, part B. Now we are just going to discuss about the deworming. Again, the set of questions I'm going to ask to Dr. Srinivas B. Edge. Are you ready,
Good
sir?
afternoon. Yeah, good
As you all know
afternoon.
that we have just selected very simple questions, very simple basic questions, because our target audience are adolescents, youth, parents, teachers, and all the stakeholders of the adolescent health. So maybe the questions are very simple, but I think the common public must know the answer of all these questions. So over to Dr. Srinivas, sir. Why is deworming important for adolescents?
First of all, thank you for the organizers for giving me the opportunity to speak on this forum, ma'am. As you know, the infections from worms can impair nutrition uptake, leading to malnutrition and impaired physical and cognitive development, as already highlighted by Dr. Deepa, ma'am. So, deworming is important as it enhances the nutrition absorption, combats anemia, and also strengthens the immune system. That's most important. All of which are vital for the healthy growth and development during this crucial stage of life for the adolescents, ma'am.
Now, Dr. Srinivas, please tell me what are the common types of worms that can affect adolescents, especially adolescents?
Yes, ma'am. Common worms that usually spreads through the contaminated food and water, soil, or poor hygiene include commonly the roundworms, which are very large worms, live in intestine. Sometimes they can be seen in stools or vomit. And secondly, the hookworms, which enters the bodies through the skin, often walking the barefooted in the contaminated soil. And these worms, as we know, the feed on blood in the intestine. The next common worm, what we see is the whipworm, which we have and the next one is a pinworm, which is very common in school-going children. And children and adolescents this spread easily from person to person. And the main symptoms, as you know, it will be intense itching during nights. The other last common worm is the tapeworm, acquired by eating undercooked pork or beef containing larval cysts. So maintaining a proper hand washing, using footwear and safe drinking water, and washing vegetables and fruits and deworming regularly will prevent this now.
Thank you, Dr. Srinivas. And now tell me, how is deworming typically administered? You have already answered this question, but anything specific you want to add in this question?
Usually administered through oral tablets or syrup. Commonly used, we use albendazole, mebendazole, and pymol pomade. And also, I want to enlighten that there are school-based mass deworming programs which are conducted every 6 to 12 months for children and adolescents, which is of great use for the children. Yes, ma'am.
Yeah. And what are the benefits of deworming in adolescents?
The benefits include.
What are the benefits of deworming in adolescents?
Yeah.
How does it?
Includes improved nutrition status, better growth and development, increased energy and reduced fatigue, and enhanced cognitive performance. That's most important, and improves immunity and overall health, and better menstrual health in girls. And also at the community levels, we need to know that it lowers the transmission of worms in the community. It's most important.
And how often should a deworming be done in adolescents?
It depends on the prevalence in the community. If the prevalence is between 20 to 50%, we need to deworm every 6 months. If the prevalence is more than 50%, I think according to the program, every 3 months, that's 4 times a year. Or if the prevalence is less than 20% in the community, it's once a year.
Okay. Thank you, Dr. Srinivas.
Thank you.
Now, round 2. And in second round, we are going to cover menstrual health and hygiene, which has been divided in 5 parts: understanding the basics, myths versus facts, hygiene and self-care, health and awareness, social and emotional support. So, for the first part of menstrual health, round 2, I'm going to ask few questions to Dr. Sunujan regarding understanding the basics. My question to Dr. Sunujan is, what is menstruation and why does it happen?
Okay. Menstruation, that is defined as a monthly shedding of uterine lining lasting from puberty till menopause. The average cycle, it's a vital biological process, and the average cycle may last from 28 days, but can range from 21 to 35 days. And the why, next question is why. Why does it happen? Because it's regulated by the...
usually start?
Yeah, usually it starts between 10 to 16 years, but the average is around 12.5 years. And it's influenced by various factors, including genetics, overall health, nutrition, and socioeconomic conditions.
Okay. So is it normal for the cycle to be irregular in the first
Yes, yes,
years
it's
after
very
marriage?
common. These cycles may be irregular, maybe even anovulatory. There may not be any ovulation also, so it can be irregular.
Okay. Does every girl get the same cycle length and flow?
No, it might be different. The cycle length might be different, can vary range from 21 to 35 days, and the flow can also be different in different girls.
Okay. So I think menstrual cycle now has started by the age of even 9 years also. Girls
Yes,
came with the
yes,
same
yes.
thing. They have started menstrual cycle. So I just want to mention over here that this is the biggest revolution in our whole generation. We can see because the revolution takes thousand and thousand of years. And we are seeing, we are the generation who are just seeing the change of age from 14, 15 to 9, even 8.5 years, the menstrual cycle is going to start. So this is the biggest revolution we generation just are going through. So thank you, Dr. Sunojan madam, for giving the answers in a very simple and basic manner. Now, part B, myths versus facts. And my question to Dr. Deepa Pasi is, can girls take a bath or swim during their periods? Dr. Deepa.
Yes, it is completely safe and it helps
Yeah.
maintain hygiene also, but they have to make sure that the whatever menstrual product, whether it is tampons or the menstrual cup, is also fine for them.
Okay. Is playing sports or during doing exercise safe during menstruation?
Yes, exercise can actually reduce the cramps and improve mood and boost the energy levels because it releases endorphins, which are the natural pain relievers and which reduces the pain. So it also improves the mood and they lowers the stress because it decreases the stress hormones and increases the good hormones like serotonin and dopamine. So the mood swings are also taken care of and it reduces the bloating and also improves the energy level.
Perfect. So it means you want to tell to the audience that exercise can be done.
Yes.
And there is no
light
harm in doing
aerobic
exercise.
exercises can be done.
Okay. Thank you, Dr. Deepa. Now my next question is, do periods mean a girl is now ready for marriage or childbirth?
Actually, menstruation periods are only a part that the body is biologically capable of reproduction. But emotionally, socially, psychologically, and physically, the girl is immature. So that is the take-home point message.
Okay. Is it true that you can't touch plants, food, or religious items during periods, or you can't go to the puja ghar and you have to just lock yourself in a separate room without touching anything? So no one can touch you also because you are impure. It is said like that because this is a taboo in our society. So what is your opinion regarding this?
Well, menstruation is a natural biological process and it does not make the girl impure, but she can participate in all normal activities. In the earlier era, why it was done so that because there's a lot of pain involved and so they wanted that the woman should rest. So that is why the adolescent girls were refrained from entering the kitchen and all. Otherwise, there is nothing wrong with it. She can continue with the normal activities.
Yeah. Now, can periods be stopped if you drink cold drinks or certain foods like you are taking achar, then your bleeding will be, yeah, your flow will be heavy. And if suppose you are taking some routine blend diet, then your flow will be okay, like this. Do you think like this? It's okay?
See, diet has no role in stopping periods, but of course, taking few foods can definitely help allay the pain and thing. But menstrual flow is mainly controlled by the hormones and not by food.
Yeah. So thank you, Dr. Deepa Pasi. Now I request Dr. Shibu for taking further questions from Dr. Anita Patil. And this time the hygiene and self-care. This is the subtopic of menstrual health and hygiene we are going to ask. Over to Dr. Shibu. Dr. Shibu, are you there? Dr. Shibu?
Yes, madam.
Yeah, please.
Okay, Dr. Anita Patil, welcome
Yes,
back.
Dr. Shibu, yes.
Regarding hygiene and self-care, what hygiene products can be used during periods?
During menstruation, maintaining good hygiene is essential to prevent infection and discomfort. So commonly used products are sanitary pads, then tampons. The sanitary pads most commonly used, easy to use, but need to be changed 4 to 6 hourly. Tampons are allowed, whereas it allows swimming and they can do physical workout. Whereas the menstrual caps, they are small silicone rubber caps which are inserted into the vagina. and can be worn for up to 8 to 12 hours. And there are some menstrual dishes also which are available now in the market. So there are so many options, but no, mostly used are the sanitary pads.
How often should sanitary pads or menstrual cups be changed?
Sanitary pads has to be changed every 4 to 6 hourly, whereas menstrual caps has to be changed 8 to 12 hourly.
Okay. Why it is important to wash and dry resumable clothes pads properly?
Washing and drying reusable cloth pads properly during menstruation is essential because it prevents infection, maintains hygiene and odor control, and prevents skin irritation and ensures safe reuse.
Okay. Another important question: how should used pads be disposed of?
Uh, Proper disposal is of a sanitary pad is very important for a personal hygiene, community cleanliness, and environmental safe. It has to be the pad after use has to be wrapped properly, uh, inwards, inwards, and it is then covered with a paper and put it in a covered dustbin. It has to be taken care never to be flushed into the toilet because it blocks the drainage.
Okay. Okay. Thank you, Dr. Anita
Can I
Patil.
come in over here, Dr.
Yeah, yeah.
Anita?
Yes, yes.
With the disposable, now the thing was there's a red dot wave, so that you put a red bindi over it and dispose it off so that it knows it's a biological blood product. So that is also there.
Okay.
Yes.
Thank you. Thank you, Deva madam. Dr. Srinivas sir. Dr. Srinivas sir.
Hello, Dr. Srinivas. Meanwhile, we'll just take the question from Dr. Sonu John. Dr. Chibu, please take the question from Dr. Sonu ma'am.
Okay.
Regarding
Okay.
regarding social and emotional support, madam, how can friends support each other during periods?
Okay, friends should be mutually supportive and there should be safe space for communication among them, giving space to address their needs, like those like in work, studies, etc. Should be being non-judgmental and not casually dismissive about their mood changes. They should be mutually supportive and the friends should support each other during their periods.
Okay. How can we talk to parents or teachers about period problems without hesitation?
Children should be aware that they should have an early and open discussion regarding their body parts and the changes expected before the start of puberty. And these topics should be normalized regarding these body changes, should be normalized even in family and in school settings also. And it should have a clear idea about clear and correct name of the body parts, especially it should be taught to kids even at a young age. Even at a young age, they should learn about all this. So they'll be freely talking to parents and teachers about their problems without any hesitation.
Another important question: should boys also learn about menstruation and why?
Yes, they should be learning about menstruation and they should be empathetic and supportive to any woman whom he is going to come across his life. They should be totally aware about the menstruation and should give a total support to the woman.
Okay. Madam, how can schools make menstruation friendly environments?
Schools should make the menstruation very friendly environment. They should provide a very friendly environment. They should not take periods or menstruation as taboo. And the students should have easy access to the products. And there should be areas to easily dispose of the soiled products. And should also bridges education or work gap in case of absence. And they should be provided with clean washrooms. And they should be aware about the menstrual health management. And classes should be taken for both boys and girls.
Madam, what can we do to fight menstrual stigma in our community?
Okay. Change the outlook from stigma to the understanding that it's just a change that tells you that the girl is healthy. And there should be public health awareness program challenging the myths or debunking the myths and involve the men and boys also in the society for these classes and address some period poverty or work against period shaming through campaigns. Then promote periods positively and public free access to menstrual health related materials in their own language. And thus we can fight this menstrual stigma in our community.
Very well explained, madam. Thank you, madam. Thank you, Sinu, madam.
Now I think Dr. Srinivas sir has joined with Dr. Srinivas. Can you see on the screen? Okay, so one question from each panelist. What symptoms are common during periods? Dr. Anita, bloating, mood swings. Dr. Anita, what symptoms are common during periods? Cramps,
During
bloating,
periods, the girls may experience little cramps in abdomen, backache, or few girls initial period may tell of some weakness, but commonly whom I have come across don't have many major problems during menses at all.
Okay. Dr. Deepa, when should you see a doctor for period-related problems? Dr. Deepa.
Yes. For the period-related problems, they can be either excessive pain, which already Dr. Neeta has said that you dysmenorrhea if it is going out of hand, or there is excessive bleeding like menorrhagia or passage of clots, or there is less passage of, blood flow, or, scanty blood flow is there. And one thing we have to make sure that whenever the menarche occurs, the initial few years can be and ovulatory, they can be irregular. So we have to wait for the initial 2-3 years. And then if it is still persisting, then of course we have to visit a doctor.
Answer to the question.
Next question.
Now, Dr. Sunujan, we have discussed about anemia, but now I want to ask, how can heavy periods increase the risk? Vivekji, please mute the public. Please mute.
Madam, unmute. Sangeeta, madam, you are muted.
Unmute. You are muted.
Yeah. Sunu ma'am, we have discussed about anemia. Now I want to ask, how can heavy periods increases the risk?
Yeah, heavy
Dr.
periods
Sunujan.
means there is increased flow, no? So they can be, the hemoglobin get lowered easily and can produce anemia, heavy bleeding.
Okay.
Serum ferritin will also get low, and that causes severe anemia due to heavy bleeding.
Okay. Thank you, doctor. Now, how can diet and hydration affect menstrual health? Dr. Anita. How can diet and hydration affect menstrual health? It's a very common question.
Naturally, if a healthy diet, high in iron is there during menses, how much is blood loss? They may not have anemia also. Hydration, because as such during menses, the loss of blood is there. If they are well hydrated, they may not feel giddiness or weakness at all.
Okay.
To add on to this, Dr. Sangeeta, then the diet
Dr.
we have to
Deepa,
have
yeah.
magnesium and calcium rich also, because it reduces the cramps and the relaxes the muscles. Nuts like almonds, cashews, seeds, pumpkin seeds, flax seeds, chia seeds, dairy products like milk, yogurt, cheese, or fortified plant milks are also there, and dark chocolates are also very good during menstruation. And of course, vitamin C, which we have been propagating because it absorbs the, iron, helps in the absorption, and omega-3 fatty acids, which are present in salmon fish and hilsa fish and sardines and tuna and flax seeds. These are very important as a part of the food.
Thank you, Dr. Deepa. Now, just Dr. Deepa, tell me, is it normal to feel emotional changes during the cycle? Is it normal?
Yes, it is absolutely
Dr.
normal.
Deepa.
This as soon as yes, it is normal, because premenstrual syndrome, you have these mood swings. Suddenly you are feeling, anger is there, and suddenly you feel because of the bloating, there will be sluggishness. And so you are very emotionally charged. So it is very important for the partner and also for the members of the house to know that whenever your wife or somebody is menstruating, they can have these offs and on and off mood swings.
Yeah, so perfectly explained by the all panelists, because there are some in many places there are some issues of net service. So thank you, my panelists, for just giving the example answer of the question. Now Now it is the time to invite my youth champion. Are you ready, my youth champions? Miss Linisha, Dr. Ananya Singh, and Dr. Pratiksha. Miss Pratiksha. Hello, Linisha, are you there? Linisha?
Yes, ma'am.
Yeah, okay. Welcome, Miss Linisha. I'm just going to ask hypothetical and interactive questions regarding the menstrual health. And now it's your turn, you champions. And I have divided this set of questions in four part. Problem solving situations. Second is myth busting scenario. Third is empathy and inclusion. And fourth one is the health awareness. So my question to Miss Linisa, you are on a school trip and your period starts unexpectedly. What will you do first? Just very basic, and you all have gone through.
I will try to stay calm and I will take help
We
from my
all have
friend.
gone through, all the ladies has gone through such type of scenario. So will you
Hello?
Hello, Linisha. You
anything
can
else you want
answer.
to add? Oh, Linisha.
Linisha, you can answer. Madam had asked you.
Yes, ma'am. First, I will try to stay calm. I will drink plenty of water and I will take help from my friends. And if I still don't feel comfortable, I can take help from my teachers.
Sangeeta ma'am, she had answered.
Okay. Thank you. Whenever we are going, okay, you want to continue, Linisha? No. So my suggestion is whenever you are going out for a school trip and you think that your periods are near about or around, the dates are near, always keep two pads with you. Whether you are going to use it or not, but all friend may need it. So now my next question to Miss Ananya Singh, your best friend is too shy to ask the teacher for a pad. How will you help her? Ananya.
I would comfort her and will try to make her understand that there is nothing to be embarrassed about. And if she is still shy, then I would ask for a pad on her behalf from the teacher.
Yeah, good. Now, you forget to carry pads. The only option is cloth. What steps will you take to use it safely? Miss Linisha.
I will use clean, washed, and sun-dried cloths and will ensure to change them time to time.
Okay. Now, Miss Ananya Singh, just tell me, you notice a classmate has a period stain on her uniform. How will you handle it without embarrassing her?
Firstly, I would calmly approach her and inform her about the stain and would offer her a pad if she is not having one. Then I will help her to cover the stain by staying behind her or by offering her a jacket.
Okay, okay. Okay. Now, in the section of myth busting scenario, my question to Linisha, your cousin says she can't eat pickles during her periods. How will you respond?
I will try to explain to her that all these are myths and there is nothing to be worried about during the menstrual cycle.
Yes.
And I will tell her to stay calm and make her understand.
Now, Miss Ananya Singh, a friend avoids playing sports during periods because she thinks it's unsafe. What will you tell her?
I would explain her that it's completely normal and safe to play sports during periods. And I did encourage her to participate in sports in whichever she loves and support her during her periods also.
Yes. Now, Miss Linisha, tell me, someone says period blood is dirty. What would be your reply?
I will tell them that this is a completely natural process and there is nothing dirty about it.
Now, in section empathy and inclusion, my question to Ananya Singh, If boys in your class laugh about periods, what will you do to change their mindset?
I would politely explain them that periods are natural biological process and not something to be shameful or funny. It's an important phase of every woman's life and which includes our own mother and sister. So I will explain that.
Yeah. Now, Linisha, tell me, if you were the school principal, okay, what facilities would you provide for menstruating students in your school?
If I were the school principal, I would provide safe disposing facilities for the used pads in my school, and make I would try to normalize the topic of periods and would make the students comfortable.
Good. Now, Ananya, tell me, if a teacher ignores a student's request for a break during period cramps, how should the student handle it? Ananya.
According to me, the student should again explain the situation to the teacher politely. If the teacher still ignores, then she should ask for any medicine which helps with pain to any classmate or the teacher itself.
Perfect. Now, in health awareness session, Miss Linessa, please tell me your friend's periods suddenly become very heavy and painful. How will you advise her?
I would try to make her calm and tell her to drink plenty of water. And if she is worried, I will talk to the teacher or her parents.
Now, if someone says skipping meals during period will reduce pain, what's your take, Ananya?
From my point of view, it's a myth to skip meals during periods, since during periods the woman body needs more energy than any other normal days, and hence should be more hydrated and should consume iron-rich food.
Now, Inisa, just tell me, your younger sister is about to get her first period. How will you explain it to her in a comfortable way or comfortable manner? So just make her comfort.
I would try to explain her very kindly that the whole process is very natural and there is nothing to be worried about it.
Yeah. So I think my young youth champion has answered all the questions very nicely. Now, the last question from the youngest amongst all, Miss Sai. Only one last question I want to ask you because your period has started recently. Only one but very important question. What was your experience when you got your first menstrual cycle? Please share with us.
I was shocked.
Miss Sai, who is only 13 years old and recently she has got her menstrual cycle. So I think this is the perfect question to be asked by her. Miss Sai.
Hi, I'm Sai Pushparaj. I was shocked and confused. I was thinking what is happening with me. Then I told it to my mother, and she guided me so nicely. I did have mood swings to eat chocolates, something sweet. So,
Okay. So, yeah. Now the forum is open for question answer session. We are just in time. It is 4:14 p.m. If anybody is having any query, the esteemed faculties are with us. So I request to all the audience, pediatrician, adolescent health specialist, if they are having any query, they can very well ask to the panelist. And then we will go for vote of thanks. Any questions from the audience? I'm just going to stop the sharing of screen. Okay. Uh,
Nice interactive session.
any questions from the audience? Because, yeah. My screen has stopped, no? Deepa ma'am?
Yeah.
Yes.
Oh.
Okay.
It is.
Any questions from the audience or anybody want to just highlight on any topic? Can also just join with.
So can I say something? A lot of times, parents
Yes, ma'am.
lot of times grandmothers are there and they have a lot of problem with the youngsters, what we were talking, achar nahi chuna, wo nahi chuna. Now, can anybody give a method of how to convince them? Otherwise, there's a lot of problem at home.
I'm sorry, I was because of pure connectivity, I was out of the session.
Sir, actually, I should ask, sorry to you, because I had taken your questions and asked to another panelist. So I had divided each question to my remaining panelists. So sorry.
I want to highlight, I want to tell one thing.
Sir,
I want to tell one thing. This is
Okay.
the one book which we need to. This is written by Tisika Chopra of Tare Zameen Par. This book is What's Up With Me. This book usually I present to all adolescent girls, but for birthdays and all. This book is so simple and easily understandable so it will solve most of their queries actually. So this book is very well written for the young adolescent girls to understand their bodily changes. This thing, one thing I wanted to add.
Thank you, sir. Thank you. It's a very important highlight you have given to us. Please share the details of the book. I will share in all the groups.
Yes, ma'am. I'll just share the book.
Everybody should understand and be easy for this taboo of menstrual health and hygiene. Okay.
Thank you, ma'am.
Share with me. Any question from the audience?
Yes.
My youth champion want to ask something to the faculties, panelists. Okay, I think today we are going to finish before time because I was very much strict to follow the time and requested to the panelists to be precise on the topic and to answer the question. Dr. Hima Bindu madam, are you on the board? Hima Bindu madam, are you on the board? I can't see her. So I think nobody is having any question because it's a very common topic, but I have selected very simple questions for the audience. So I request Dr. Prakashveer Arya sir. Yes. To the session and give vote of thanks.
Yeah. This was a very wonderful session on very most important topics.
Yes.
Menstrual hygiene, deworming and anemia, common causes, common management, and जैसे सबको पता है कि more than 60% गर्ल्स और फीमेल्स में है ना एनीमिया होता है, तो इसका डायग्नोसिस करना और उनको अर्ली डायग्नोसिस एंड ट्रीटमेंट इज द main theme of today's presentation. Now I thank you very much for this wonderful webinar 18 to all the esteemed guests, faculties and young youth and the members who attended it. Thank you, Dr. Samir Shah, most important cues, Dr. Sangeeta ji, Dr. Shibu ji for the part as a moderator and MOC of the program. I thank Dr. Saeed Hubi Ali sir, Dr. Apurva Kumar Datta sir, and Hima Bindu madam for their guest as a guest and their blessings. As a faculty, I thank Dr. Sumu John, Dr. Deepa Pasi, Dr. Anita Patil, and Dr. Srinivas sir. डॉक्टर संगीता जी, आपने बहुत अच्छी तरह यूथ मॉडरेट बच्चों के साथ है ना मॉडरेट किया और उन्होंने बहुत कॉन्फिडेंटली मतलब इनके आपके क्वेश्चंस के जवाब दिए. मिस लिनेसा एंड अनन्या सिंह बहुत कॉन्फिडेंट थे, आपको बात करने में बहुत अच्छा लगा. इतने सीनियर्स के साथ हम लोगों के साथ बिल्कुल बेझिझक होकर आपने बात की. डॉक्टर शिबू, अगेन आपने बहुत रॉकिंग प्रोग्राम बनाया. ये रियली अगेन आई थैंक्स टू ऑल द पार्टिसिपेंट्स एंड ऑल द मेंबर. डॉक्टर सलीमा जी फ्रॉम यूनिसेफ, उन्होंने भी ज्वाइन किया और सभी पार्टिसिपेंट्स को. आशा करते हैं कि ये प्रोग्राम आगे भी होते रहेंगे इस साल और अगली साल भी हम सब मिलके IMA
चलते
ऑक्सी
चलते
और
डॉक्टर
सबके
हिमा
साथ
बिंदु सिंह
मिलकर
मैम
काम करें।
want
हिमा
to say
बिंदु
something?
मैडम,
Yeah,
yes madam.
thank you, Dr. Arya and everybody, the whole team. I would
Yeah.
like to personally thank Dr. Sangeeta Lodha and Dr.
Yeah.
Shibu, our
Yes.
EVP, Executive Board in charge, who have made this possible today and carrying on many programs ahead. I requested both of them to please take charge of this program. Have done it so beautifully. And my special thanks to Srinivas, who was
Yes.
IAP Mysore. You know, they are all hidden people. I mean, IHA, I wanted them to come on board so that we know about their work. They are doing so
Thank you,
much in
ma'am.
IIT in certain places. And of course, Dr. Sunu, our upcoming star from Kerala. I mean, I like her enthusiasm. I just met her today morning. I mean, she's really has so many, she's a energy, a boost of energy for all of us. Looking forward for more active participation from all of you and new faces to come up in AHA, Adults in Health Academy. I also like to thank Dr. Anita Patil, who's our own, very own AHA member, and Dr. Deepa Pasi. She's an expert, you know, she got this menstrual module. Therefore, I suddenly thought that she should be there on our board and she accepted immediately. Thank you, each and one of you. And of course, UNICEF, all our partners. Dr. Apurva has joined us from abroad. And each one of you, all the participants. This is a community-oriented program. And I hope the slides have been released by Neha Singh. She has been...
Madam, I'm going to
Please
read the
release those
slide
slides.
now.
Please release those slides. Two set of slides prepared on anemia and one on menstrual hygiene. And these slides will be given to all of you. And you can use this in your schools, colleges, contact programs. So these are very simple slides for the community, for the adolescents in the schools and colleges. You can use these slides on behalf of AHA. Yeah.
Madam, you release the slide. You just announce the release of slide. I'm just going to play
Yeah,
the
I'm very
slide
proud
now.
as the chairperson of Adults and Health
Because we
Academy
are having 8 minutes. So
on
you
behalf
just
of Wave
announce
18
to
program.
release the slide.
Yes, yes.
Breaking
I'm
silence on menstrual health.
that on behalf of Wave 18 as a Central AHA chairperson, I'm really extremely delighted to release these two slides set, one on menstrual hygiene and one on ironing out anemia. I think all kudos goes to Dr. Neha Singh, who has prepared this just a very short period. See, excellently she has done this. I think they are very simple but not very educative slides. Over to you, Sangeeta. Please release them. And on behalf, we all request all of you to utilize these slides in your contact programs.
Thank you,
Breaking
Dr. Hima
silence
Bindu,
on
ma'am.
menstrual health.
Now I'm just going to play the slide.
Yeah.
Breaking silence on menstrual health has been just designed in a pecha pucha manner, and these are the slides. Can you see my slides?
Yeah.
Yes.
Just
Yes, ma'am.
so very simple, scattered, colorful, and we have just given the touch of pink color. So these are the slides. Only 10 slides, and then the part 2 is just
So this is a new concept, pecha kucha. This is a Japanese term for us to, in short, just 2 minutes, 5 minutes, we need to give the content and the message. So this is a new way of, new way of technology, or you say teaching and learning method. Thank you.
Nice one.
Yeah.
Nice.
Now, madam, you announce for the second part. Let's iron out the anemia in you.
Yeah, I think all of us should do this. On behalf of all of you, I would also announce the release of these slides for
Please
ironing
announce.
out anemia in youth. With these slides, I request all of you to take up these slides in the schools and colleges. Over to you, Sangeeta. Yes.
Yes. So these are the part 2. IPAHA Youth Forum presents Wave 18. Let's iron out the anemia in youth. These are again very simple and basic slides with a very informative knowledge has been included in it. So you can just take further in the community, schools, colleges. Only 10 slides for simple and very important topic. Thank you all. Now I'm going to
Yeah, the central AHA will mail these slides to all the pediatricians. Thank you, Dr.
stop the
Sangeeta and Dr.
screen share.
Shibu once again.
Yeah, thank you all the panelists and Vivek ji, who has just given us the tech support without any glitches. And thank you, Veer Arya sir. Nice to see you all and see you all again next month with a new topic on 18th for Wave 18 Empower Yuva. Thank you. Bye-bye. Have a nice
Bye-bye,
day.
bye-bye.
Thank you,
Bye-bye.
Sneha ji.
Thank you,
Thank you.
everyone.
आप भी
Thank
रहे.
you.
Shalini madam. Thank you.
Thank you.
I am before time. 4:26. So that session,